This is Mandatory Vaccinations, Colorado's Measles Prevention Initiative. I'm Sarah, speaking on behalf of Mikey, Judy, and Tim. Our issue at hand is an increased number of unvaccinated individuals who are declining immunizations for personal beliefs. We're proposing to remove the personal belief exemption option. Vaccinations will be mandatory for all students in public school starting in kindergarten. The measles virus is a single-stranded enveloped RNA virus. Humans are the only natural hosts of the measles virus. The route of infection is respiratory and direct contact. The incubation period is 10 to 12 days, where the infected person doesn't even know they have measles. Initial symptoms are common cold symptoms: cough, runny nose, Koplik spots, which are bluish-white spots on oral mucosa. The rash will then begin. This is a textbook photo of the measles rash. The measles vaccine was developed in 1963 and quickly made available to the public. It's now given as part of the MMR vaccine series. Reactions can include mild to severe. Severe reactions are toxic shock syndrome, allergic reactions, febrile seizures, and transient thrombocytopenia. We want to make it very clear that there's no evidence of relation to neurologic sequelae, increased risk of Guillain-Barré syndrome, inflammatory bowel syndrome, or autism. The World Health Organization recommends that all susceptible children and adults be vaccinated against measles. The live attenuated measles vaccine is safe, effective, provides long-lasting protection, and is inexpensive. This is an example of the medical exemption form that we don't plan to alter at all. This form only needs to be filled out once, unless some information changes or the child switches schools. The non-medical exemptions cover both religious and personal belief exemptions. The parents must fill out the non-medical exemption form, indicating that they are opposed to vaccinations for personal or philosophical reasons, or if they plan to adhere to a religious belief whose teachings are opposed to vaccinations. This form is filled out yearly. Populations affected. As consumers, parents are greatly affected and major stakeholders in this issue. They must be educated and give consent for their children to receive vaccines. Otherwise, their children will not be allowed to attend public schools. Parents with children who are high risk due to medical conditions can then be reassured their children will have reduced risk of being exposed to a disease they likely would not be able to fight off. Providers are affected and major stakeholders because they're also responsible for educating parents on the importance and safety of vaccinations. Insurance companies are affected because they likely will receive an increased number of claims. With increased vaccination claims on the front end, there should be fewer or less expensive claims on the back end due to reduction in preventable diseases. Employers sometimes lose a great deal of money and productivity from employees who are out sick with their kids. Manufacturers will be affected because of increased, likely more consistent need for production. The Department of Public Health and Environment is responsible for tracking immunizations and the occurrence of measles or other vaccine-preventable diseases. This is our revised Colorado Department of Public Health and Environment vaccination policy. Under this new proposed policy, vaccinations will be mandatory for all students in public schools beginning in kindergarten. The only exemptions will be medical or religious reasons and must be documented and reviewed annually. Medical reasons are to be documented using the current medical exemption form. Human benefit of the new proposed policy: fewer outbreaks of vaccine-preventable diseases, less exposure of high-risk children to preventable diseases by others, fewer comorbidities caused by the development of disease which could have been prevented. Fiscal costs: state and territory health officials to ensure vaccines for uninsured and underinsured children. CDC estimates the cost of MMR as $21.05 and private sector cost $75.04. It's estimated that $7.1 billion was spent in 2015, the cost of adults not getting vaccinated. This will be greatly decreased with the increased mandatory vaccinations. Anticipated challenges. Anti-vaccine sentiments have been found to concentrate in small areas. Even with monetary withholdings or penalties, many families have shown reluctance to agree to having their children vaccinated, and they believe they're doing the best thing for their children's health. The possibility of a prolonged legal battle that will ensnare proposed legislation for an indeterminate amount of time is also a very real possibility. The CDC warns there are responsibilities and risks to rejecting vaccinations. Many diseases that can be prevented with vaccines are still circulating in the US and other countries. Outbreaks of vaccine-preventable diseases can occur and can range from mild to serious. Even one case of some diseases, such as measles, can cause concern and be enough to lead to an outbreak. Potential unintended consequences. Community rejection could lead to the creation of alternate education options. These could be substandard education opportunities. Larger concentrated pocket of individuals that are vulnerable to infection. Also, the possibility of reduced trust in the pediatrician. Vaccine-accepting parents are more likely than vaccine-hesitant parents to report that they have a good relationship with their child's primary healthcare provider and to trust that the provider has their child's best interests at heart. When we're evaluating the criteria, more immediately, the CDC will show increased percentage of vaccinated children in Colorado. More long-term, the CDC will report a noticeable decline in the amount of measles outbreaks in the state of Colorado. This graph below is interesting because here we are in February 2019. There have already been 101 outbreaks of measles in the nation, as opposed to last year with 372 as of December 31st. So it's really growing rapidly this year. An alternative course of action, a secondary. Based on ongoing analysis, it is possible we may need to amend the policy to only allow medical exemptions for vaccinations. This would be taking away religious exemption. As of 2015, California, Mississippi, and West Virginia became the only 3 states to not allow non-medical exemptions. By introducing legislation into Colorado law that will more closely mandate MMR vaccination requirements by not allowing philosophical exemptions, we will benefit our public health communities and the future of our children.